Welcome to part two of our lecture series on psychological disorders or abnormal psychology. This lecture will be talking about anxiety disorders, and as you see by this slide, there are, I think, 7 here on the list of types of anxiety disorders. Well, what does anxiety, all these types of disorders, what do they have in common? All of them include excessive worrying, fear of losing control, nervousness, and an inability to relax. And what's happening here physiologically is that the sympathetic branch of the autonomic nervous system is turned on and can't turn off. So if you remember back to chapter 2 on biology and psychology, back in our second lecture, we talked about how the fight or flight response protects us from danger to some extent. If we are confronted by the grizzly bear in our hike in the woods, we are triggered to protect ourselves. So we have all of these physiological things that happen. Our heartbeat starts to go really fast, our blood pressure goes up, blood goes to our large muscles so we can run, etc. And we've talked about that back in the chapter on biology, and we've also talked about it in the chapter on stress. So it happens in anxiety as well. But in anxiety, we're probably not under actual physical threat. However, our body doesn't know the difference, perhaps, between true danger and a false alarm. And that on switch or fight or flight is always turned on. So as therapists, we try to help people access the parasympathetic branch in creating a calming response. We teach them relaxation and meditation and coping statements and so on. Well, let's start with the very first one here, phobias. Well, what we need to do first is distinguish between a fear and a phobia. So fear is a rational response to a perceived threat or life-threatening event. If you're on that hike and you see the grizzly bear, you're going to feel afraid and you're going to try to do something to protect yourself from the bear, right? But a phobia can feel just as frightening as fear, but it's irrational. And these fears happen in response to objects, activities, or situations. In a simple phobia, a person is intensely afraid of something and they do know what that thing is. If you ask a person, what are you afraid of? They can tell you. And they feel that they can't control that fear. In the photos here, you see a guy in an elevator that's probably showing claustrophobia. He can't handle small places, or maybe he can't handle the fear of heights. That elevator is going to the top of a skyscraper, for example. So people become irrationally afraid of situations where they are perfectly safe, but they don't feel they're safe. In the middle photo, people are often afraid of knives. Of course, on the right, people are afraid of insects, spiders, that kind of thing. People are also afraid of, well, really anything you can name practically. People are afraid of blood, for example. They're afraid of flying on an airplane, which got all worse after 9/11, nearly 20 years ago. So fear of flying is a real thing. People will not tolerate getting on an airplane. So what do you do if you have to go someplace far away? I had a patient who was fearful of public transportation. He also couldn't be a passenger in a car. He could drive his own car, but he couldn't be a passenger in a car. And he was very easily able to trace this back to being a kid sitting in the back seat of a car with his sister, and dad driving, mom in the front seat, and they were in a car accident. The car spun, and so there's that terrible, fearful feeling. And as I recall the story, the sister threw up on him. So From that moment forward, he had a real hard time getting in cars, and it extended or generalized, if you recall that term from the chapter on learning, the response generalized to other types of public transportation. So he could not ride on a subway or the Long Island Railroad or any kind of train or boat or airplane. And this was really restricting his life. So by the time I met him, he was old enough to be dating and wanting to get engaged to his girlfriend. But this inability to travel was really restricting them. And she said, you know, we won't be able to go on a limo for our wedding. We won't be able to get on a plane for our honeymoon. We can't even take a vacation. So he said, okay, you know what? Let's drive to Florida and we'll go to Disney. So, okay, they got time off from their jobs. They drove to Florida. They get to the theme park. And if you've ever been there, you know this. From the parking lot, you have to take either a tram or a boat to get to the theme park because it's actually, I think, on some kind of a little island. You cannot drive into Disney World. And he couldn't get himself to go on either method of transportation. So they didn't make it to Disney. They went to SeaWorld and some other attractions. And when they came home, she broke up with him. So very sad, right? Very, very sad situation. Wouldn't overcome it. Now, I was working with him. So what was I telling him to do prior to this travesty? I would say to him, you're not going to want to hear this, but you have to do the thing you're afraid of. You have to slowly introduce yourself to the fearful situation and learn. You have to retrain your brain. You have to learn that you're fine. So I'd say go to the Long Island Railroad station and go one stop. And out here on Long Island, sometimes those stops are pretty close, even a mile and a half away. So he could be on and off the train in no time. But just keep practicing that. And he just refused to do it. He refused to do it. And he didn't overcome his phobia. And I mean, talking about it is fine. We figured out where it started for him. But unlike Freud's idea that if you have that aha moment and you know where it all started, and that's the cure, that's not the cure. Your brain is still responding to situations that should not be creating all of this fear, and it does anyway. You have to retrain your brain. So if any of you are having phobias, you have to practice it in small doses, systematic desensitization, it's called. Practice it in small doses to slowly overcome the thing that you're afraid of. If you're afraid of flying, go hang out in an airport, walk around, see if you can see the big planes landing and so on, and recognize that it's fine, it's normal. Okay, so simple phobias, people know what they are afraid of. They can name it, but they don't feel they can control it. In panic disorder and agoraphobia, there's the same feeling of intense fear and tension. The difference is that the person doesn't know what the triggers are. So in a simple phobia, you know what you're afraid of. In panic disorder, you don't know. You feel overwhelmed with fear and anxiety and dread. And your sense is that something is terribly wrong. People usually think they're having a heart attack because those physiological symptoms have kicked into high gear. But they look around and they go, but I'm just standing in a line waiting at the grocery store, or I'm driving my car someplace and I'm not worried about anything, and all of a sudden I have these physiological feelings. And worse than that can be agoraphobia, which typically starts with panic attacks. And agoraphobia is that feeling of being unsafe and highly anxious when out of their safe zone. So a person might say, you know, I was shopping at the store and I had this panic attack and I couldn't wait to get home. So once I'm home, I feel safe. And then they start to realize that every time they go out, they have this feeling of panic. And that is called agoraphobia, because what's happening is they start to avoid going out. And sometimes people can't ever even leave their house or even their bedroom. Other times people can leave their house, but they sort of have what they feel is their safe zone. You know, they can get to their kids' school, they can get to the grocery store, um, they can be in their neighborhood. But outside of a few miles, that agoraphobia kicks in and they run home. So you can see, if you remember what negative reinforcement is, when they get home and they feel better, that very unpleasant feeling is removed, right? It goes away. And so that reinforces the fear. So, I mean, there's two ways to approach these problems. One is strictly behavioral, like recognizing that this is negatively reinforced. So this fear is being maintained by avoiding the situation you're afraid of. So just like with simple phobias, you do have to get out and start slowly, get to that area outside your comfort zone and stay there for a while and try to induce a calm response. Sit and meditate, sit and take deep breathing. Sit there and recognize, look around and go, I'm perfectly safe. And then when you're feeling calm, you go back home. Okay, so you can fight it, but you have to work on it. It's hard to fight it because the fears can be very intense. You just recognize that this is an irrational panic. It's not attributable to anything. You're not dying. You're not having a heart attack. It's just uncomfortable feelings where your body is triggered, but with no particular reason to be. The other treatment that I often use with people is to say, what is the unavoidable or inescapable issue in your life? So what is the word panic? That means in real life, if we're panicked because of a dangerous situation, then that means there's no escape, right? We're trapped in a burning building, there's no escape. We might panic. Okay, well, a person who's having panic attacks might be facing some unavoidable or inescapable issue in their life, and therefore feels a sense of panic. So, to tell a story, I had a patient once who was she was getting panic attacks, and she would get them on her Friday nights when she was bowling, and she couldn't figure out what was causing it. And um, a year prior to that, her husband had had an issue with, he had become mentally ill. He had had a psychotic break. And they went through all of the treatment for him. And he recovered and he got back up on his feet and he got back to his job. And she started to have panic attacks. So, what was the unavoidable issue? Well, her husband was better, but he could relapse. There's nothing you can do about that, right? It's something that could happen. And underneath everything, although she felt like, okay, we're getting our life back together, there was that fear that it could happen again. Another patient of mine had panic disorder when she realized that, her parents were getting old, and one was developing dementia, the other one had a heart condition, and that she was going to have to take care of them. But more than that, just seeing the loss and the decline of the health of her parents, it was unavoidable and it was sad. And she was developing panic in response to that. Okay, so that's another type of anxiety disorder. There's also social anxiety, which is a fear of embarrassment or negative evaluation. Sometimes it's classified under the phobia category, or it's called social phobia. And it's a little different because it's not so much like you're afraid of spiders. You're afraid of some kind of situation where you think you might become embarrassed or that people would criticize you. So most people, almost everybody, has a fear of public speaking. They can be shy, there can be stage fright, there can be fear of dating. These are all examples of social anxiety disorder. Some people are actually afraid to call people on the phone. They'll text them, but they won't call them. They get very self-conscious. Another one, if you ask students in a class, especially the women, are there foods that you won't eat on a date? Almost all of them will say yes, because they feel like it's too messy. So they won't eat fried chicken or corn on the cob. They won't order any food that looks too fattening because they think they'll be judged for eating fattening food. They skip dessert. So these are all social phobias. Sometimes people have a fear of meeting new people. So these are all social anxieties and social phobias. Can they be dealt with? Absolutely. You say, I need to get over it. It's it's affecting my life, and it's stopping me from meeting some of my goals. So you work on it again, slowly but surely, doing the thing that you're afraid to do until you become comfortable with it. Generalized anxiety disorder are all of those similar feelings, but they're sort of constant. So panic disorder comes and goes. A person will feel perfectly okay and living their life, and they'll have periods of panic where it lasts for a few minutes, and then it goes away. In generalized anxiety disorder, it's this constant worrying and dread, and really no understanding of why. There's trouble concentrating, there's forgetfulness, there's disorganized thinking, and it can include physical symptoms such as muscle aches, sleep problems, stomach problems, a sense of jumpiness. Now, people go through anxiety. We've living through a pandemic, living through financial insecurity for some people, worrying about the health of ourselves and our loved ones, maybe taking care of sick people, dealing with that, dealing with loss, all these pressures that we've talked about throughout the semester with stress and so on. Anxiety in response to all of this stuff is so normal. So we may go through periods of anxiety just in life, and that's normal. I mean, that's stress. That's stuff we live with. So we don't diagnose someone as having generalized anxiety disorder unless they've had these symptoms for more than 6 months. And what can we do about it? Well, there's medication that can help, anti-anxiety medication. And for some people, problem solving. They don't know what to do about some situation in their life, and the anxiety is getting to them. Well, let's solve the problem. How can we solve the problem? So I have a friend who needs to take an exam to get a professional license. And you're allowed 3 chances to take it. He took it once and failed. So now his test anxiety is through the roof. And he's been avoiding taking this test for over a year. Well, temporarily that solves the problem, right? You avoid the test, you avoid the anxiety. But it doesn't really solve the problem because now he's really stuck in his life, not able to go ahead and continue his career. So how do we solve that problem? Well, you can increase your studying. You can take practice tests and hopefully get good marks on those. You can take a medication, but ultimately he has to take the test, right? If he doesn't take the test, it'll upend his life if he waits too much longer. Another type of anxiety is called OCD, and this is obsessive compulsive disorder. It's the kind of term we throw at our friends sometimes when they're being prophetic. It's like, oh, you have OCD, or when your mother wants you to clean up your room and you don't feel like doing it, and you're like, oh, mom, you have OCD, like leave me alone. Well, in everyday language, people probably don't have OCD, but it is a real thing. So let's talk about it. It is one of the few disorders that has sort of two separate but related symptoms. The first part is obsessions. Obsessions are thoughts. And what kinds of thoughts? They are recurring, irrational thoughts that a person can't suppress. They can't stop thinking about these obsessive thoughts. And so it's always on their mind. Secondly, the person has a compulsion, which is an irrational behavior that the person can't stop. So obsessions are thoughts, compulsions are behaviors, and the two things are linked, they go together. Well, what happens? A person's obsessing over some thought, and they perform the behavior, they do the behavior, and that's the compulsion. And their anxiety temporarily goes down. They feel a little bit relieved, but then the obsession comes back. So let's take a person who is irrationally afraid of germs, and every thought they have is of contamination. Well, so what would a person like that do if they were constantly worried about contamination? They would probably wash their hands a lot, right? Now, what's rational, what's irrational while we're living in these times? It is rational to wash your hands several times throughout the day. We are supposed to do that. It stops the spread of disease. And so that's good, right? We wash our hands before we eat, before we prepare food, after the bathroom, and so on. It is not rational to wash your hands 500 times a day. So a person will have a fear of germs. They obsess about it. And then, so they wash their hands. So they go, oh, good, I got the germs off my hand. I feel better. I feel better. I washed my hands. But then you touch something. You touch a light switch. You tie your shoe. You pick up a pen. And now you go, oh, that's probably got germs. I got to go wash my hands again. Okay, so the anxiety goes away for a moment after you do the hand washing, but then the obsession comes back, and now the anxiety spikes again. You can imagine how badly it would interfere with a person's life to live with this. People who are really, really affected by OCD can do very little else because they can't think about anything but the obsessive thought. I did have a patient one time who had OCD. He was chronically late to his appointments because he couldn't get out of his house. What was he doing in his house? He was checking all the light switches and outlets to make sure that they were safe. He had this obsessive thought that somehow if he didn't turn out the light switch properly, there would be an electrical, misfiring or something, and that would, cause a fire. Okay. He also thought that he might cut his eye while he was shaving, or he thought he might get glass splinters into his eye. And I said, how would you get a glass splinter into your eye? He said, well, maybe I would step on a piece of glass and then touch my shoe and then it would go into my eye. So he would come up with sort of an explanation of how these things might happen. Of course, the odds of this happening were next to nothing. He sometimes would think that while he was driving his car that he had hit somebody with his car. And that actually is a very common obsessive thought that people have, that maybe I hit somebody with my car. He would get out, he would stop, and he would get out and check his car for any damage to his car. So these are obsessive thoughts would keep him from holding a job, keep him from getting to appointments on time, just really stopped him from being able to do anything, right? He was paralyzed by this OCD. So what is the treatment for this OCD? Well, it's like everything else. You have to do the thing or not do the thing that's causing you this. You have to change your thought pattern, and you change your thought pattern by changing your behavior. So if you're obsessed with germs, then you would have to agree, I won't wash my hands. Now, it's really, really hard to do that because you feel like I have to do it or something terrible is going to happen. But if you try to stick with the program, working with a therapist, and not do the compulsive behavior, then you would realize I'm healthy, I'm safe. I didn't run anybody over with my car, I didn't get glass in my eye, I didn't get an illness, etc. Okay, so it's hard. And there is medication for this as well. It is a brain disorder that a part of the brain that controls our ability to stop doing things is not working properly. So we just keep going throughout this cycle. I also come back to this notion of what's the unsolvable problem in your life. Now, with the guy I was just telling you about, he didn't stick with me long enough for me to figure that out. He moved on to a different therapist, which was good because I didn't think that 1 hour a week with me was going to do the trick. He needed more intensive help. I had another client who was afraid that she had molested a child. Now, here was the background on her. Her whole life, she had wanted to be a teacher, and she had a mild learning disability. Her parents always told her, "You'll never be a teacher. You'll never make it. You'll never be a teacher," which was kind of mean, right? Kind of cruel. I guess they were trying to be realistic with her. I don't know. But she went to college and she got an education degree. And it took a while, but she got it. And she got a job at a daycare center where she was taking care of, you know, preschool kids and toddlers. Really, really happy at her job. And she was good at it and she was likable and they gave her a promotion. So now she's given a job where she has to write curriculum. She has to plan the program for the kids. Now she literally was in over her head. She didn't know how to do it. And she started to not like her job anymore and feel like she was going to fail and get fired. She might have because she couldn't do that end of the job. She didn't know how to do it. So one day she's changing a diaper of a baby, a toddler, which was part of what she was supposed to do. And she thought maybe she had brushed her hand against his penis in the act of changing the kid's diaper. And that thought bothered her so much that she called out sick the next day. And she became absolutely obsessed with this notion that she had molested that child. So if you molest a child, you can't work for a daycare center, right? So she quit her job and continued to be obsessed with this notion that she was a child molester. So, and of course she wasn't, but she wouldn't see her nieces and nephews. She wouldn't walk through a grocery store without holding onto the shopping cart with two hands. She would scan the television news every night thinking she was going to see her name on TV news as wanted for child molesting. She would hear a helicopter and think they're coming to get me. So she absolutely got psychotic about this. And so what was the unsolvable problem? The unsolvable problem was she wanted to be a teacher and she wanted to prove to her family she could do it. But she actually, over a certain level of what that meant, could not do the job. So she was either going to have to admit to her parents that they were right, or she was able to escape the challenge of teaching by developing this OCD. So it's kind of Freudian in a way. It's like she developed the symptoms to escape a problem, but I do think that's kind of what happened in her case. She eventually got a job working in an office, and she had to fight the compulsive behavior a lot. So she wouldn't walk down the hallway without carrying like a file folder or something because she just thought she might grab somebody. And again, she never had, just to reinforce that point, done anything inappropriate, but she felt like she might, and that's the obsessive thought. Okay, so, but as she fought this thing, she got on some medication to help with the anxiety. She did improve, and she ended up working not in teaching, of course, but um, doing some office clerical work. So she did get better. Okay, hoarding is one of those diagnoses that we talked about in the last lecture that's new to the DSM-5. And you see a couple of pictures here of messy hoarding and neat hoarding, but either way, it's an overpowering need to accumulate possessions and trouble discarding them, even when there are duplicates or there are useless things, broken things, or even health hazards such as rotting foods or even dead animals. And of course, you can see how this could create fire hazards. And so what happens? This is not just a person who's extremely messy. Trying to get rid of these items creates extreme anxiety and actual loss of identity for a person. Their whole identity of who they are is wrapped up in their stuff. And so sometimes well-meaning family members or friends will say, well, I'm going to clean out your house for you. And they throw all this stuff away and or donate it, whatever, but they get rid of it. And the person just cannot stand it. They just get bereft over the loss of these items because they just feel like, well, that's who I am. So hoarding is a public health problem. It doesn't come to people's attention until sometimes till someone goes in their house. But it could be a public health problem if it's drawing rodents or something. And it can certainly be a safety and individual health problem. Body dysmorphic disorder is an obsession with bodily perfection. And the person is obsessed with perceived physical flaws, often things that other people don't even notice. And the person feels extremely embarrassed and ashamed of these so-called flaws. And that can lead them to plastic surgeries or other extreme measures of altering the way they look. So here's Michael Jackson in 1977 and 2006, who had multiple surgeries to change his appearance. You can see the change in his appearance and skin lightening, and his eyes got bigger, his eyebrows more arched, his face more sculpted, lips enhanced, and so on. It's hard to understand why. What was he thinking that he thought that either that this looked better or what? But anyway, I would just consider this body dysmorphic disorder, which is a type of obsessive compulsive disorder, right? They are obsessed with the way they look. I had a patient with that once, a beautiful young woman in her 20s, tall, graceful, sort of moved like a dancer, and she had this long red hair, and she was obsessed with her body in an unhealthy way. She was not anorexic, but she thought she was ugly. And she would complain about, well, everyone else in my family has brown hair. Why do I have to be stuck with this red hair? Well, she could have colored her hair, but I'm glad she didn't because it was very striking. But she would say, why do I have to be so tall? I wish I wasn't so tall. And I mean, you can't really change your height, right? And she would obsess over it and think she was unattractive. So it was really sad because her self-esteem suffered, and needlessly, at least regarding her appearance. PTSD is something you may have heard of, post-traumatic stress disorder. And that condition of anxiety that follows a life-threatening trauma or witnessing one. So it happens to you, or it happens to someone you know, or that you witness something. So even if you're a witness of a severe crime or severe car accident, say, or if you're personally involved in it, you can have stress reactions after the event. And that includes physical symptoms. So it's all that same stuff with anxiety, racing heart, and so on. Flashbacks, meaning you have these uncontrollable memories of the event, the life-threatening event. Nightmares, jumpiness, An increased startle reflex. So that means, that jumpiness when you're very, very tense and somebody makes a loud noise and you jump. That's your startle reflex. Emotional outbursts in response to the trauma memory. So a hard time handling their emotions. These folks feel like nobody understands them. So it was first recognized in soldiers coming back from war. Back in World War I think it was called battle fatigue. It's had other names over the years, but they finally diagnosed it as post-traumatic. So you hear that post after the trauma. And imagine coming back from war to your nice, safe family and home, and people don't understand what you went through when you were in combat. It's very hard to explain it to people, and a lot of explain it to people because they feel like, why would I upset my family member with telling them about the horrors of what I saw over there? So it would be common for a person to feel like nobody really understands me because they don't know what I went through. And that can be the case for any kind of trauma, whether it's domestic violence or other kind of being a crime victim, being, in a fire or natural disaster. And the memories of the event don't feel like memories. They feel like they're happening now. It's not like, oh, that happened 10 years ago. It's happening now. And they can get triggered. So a patient of mine was a victim of physical abuse when she was growing up. Her father would beat them for no particular reason with a belt, leave welts. She would hide. At one point, he pushed her down a flight of stairs. Very scary things. And then she got married, and her husband, who was sort of nice before the wedding, started doing the same kinds of things to her. And, would push her up against a wall and put his hand over her face and so on and try to choke her, stop her from screaming. So she got away from both her father and her husband, fortunately, and has been away. But she suffers from PTSD. So anything that reminds her of, mostly now, the ex-husband, makes her feel as if it's happening now. So what does that mean? Well, she's fearful to go out. She's got a little bit of agoraphobia. She won't go out very much because if she sees a car, it reminds her of her ex's car, or thinks somebody might be following her, she becomes very afraid. And even to put a mask on now, we all have to wear masks with the virus. She says putting on a mask, even though she knows it's not rational, triggers the PTSD because it reminds her of it over her face. So she suffers with this quite a bit. Anyone who's gone through a stressful or traumatic, life-threatening event is going to feel those fearful symptoms for a while. We can't stop. We can't help but think about, reliving the accident or reliving the fire or reliving the crime or reliving what we saw. That's very normal. So we don't give a diagnosis of PTSD unless the symptoms are occurring 6 months after the traumatic event. So if you're still feeling that way after 6 months, you might get this disorder. Acute stress disorder is the same thing as PTSD and for the same reasons, but they occur immediately after the event. Okay, so this is what I was just referring to. If you are in a life-threatening situation and you're safe, but you have this stressful feeling, it'll usually go away within the first 6 months. And that would be acute stress disorder. So a patient of mine was on a city bus, and someone stormed the bus at a bus stop and was yelling and screaming, and I think he was waving a gun or a knife or some kind of weapon, I forget what. and everybody escaped through the back door of the bus. Okay, so she felt this fear and nightmares and this fearful feeling for a little while, but it went away. After a month or less, she recovered from that. And at first, she was avoiding the bus, but she had to get to work. So she got back up on the bus and she was fine. So acute stress disorder would have been the proper diagnosis for her because it happened immediately, but then it did go away. So it's not post-traumatic stress disorder unless those symptoms last longer than 6 months. And that's the good news, because people can go through all kinds of horrific things, and we do in life. That's life sometimes throws these things at us. And the fear is, oh no, I'll be living with this trauma forever. That's not necessarily the case. Most people recover from stressful events like this, and it might take a little while, but most people do recover. So if something happens to you or someone you care about, don't worry that they'll have to live with this forever. It might not be. Okay, they might just eventually just get to be just fine and move on. Okay, we're going to stop here with our second lecture, and tune in next time.